Good evening, everyone, and welcome to NBC 6 Voices on our YouTube and Facebook pages. I'm Jawan Strader. We're going to have a great discussion on the COVID vaccine. We're going to talk about myths. We're going to talk about the disparities going on in the Black community. So thank you so much for joining us. Let's get right to it. And we're talking about combating COVID vaccine distrust in our community. Black Americans continue to receive COVID-19 vaccinations at dramatically lower rates than white Americans, even as the rollout reaches more people. The gap is troubling given that the coronavirus continues taking a disproportionate toll in severe sickness and death in the Black community. You've seen the numbers. There are many reasons for the vaccine disparity, though, and so we're going to get right to them tonight. We're going to discuss those disparities. So please welcome our guest, Dr. Hansel as an infectious disease specialist at the University of Miami Miller School of Medicine. Also, Dr. Zinzi Bailey, she's a researcher, a social researcher at the University of Miami, where she studies health equity. And Daniella Pierre, she's the new president of the Miami-Dade NAACP, friend of mine as well. I know her very well. And so let's get right to it. First of all, thank all of you for joining us for this special Voices. I really appreciate it.
Thank you.
All right. And so Dr. Tooks, you got to remember, we got to take you off that mute button. There we go when we start. So let's get right to it. So let's go ahead. I'm going to shoot out some questions for each and every one of you. And Dr. Bailey, let's start with you. In South Florida, people of color who are over the age of 65 are slower to get vaccinated at lower rates. Why is that the case? Why are we seeing so much of this?
So as an epidemiologist, I am focused on thinking about how something happens across the population. So essentially, as we're looking through what has happened thus far, we can see that we're not operating on a level playing field. COVID from the very beginning has been operating and laying bare all the structural inequities that we have in place that are part of our nation, a part of our state, a part of our county. And so we're starting to see some of that, right? And when we're talking about those who are 65 and older, when there's a lot of urgency around this vaccine, let's get it out. You might have very limited time and information that's communicated from federal government to the state, to the county, to a locality, to a health system. So things have to operate very quickly, right?
Sure.
If we rely on online systems, Twitter alerts, if we rely on websites solely, we're not going to get those who are 65 and older in the best way necessarily, and it necessarily structures who can get that information and who can have access. So if you know somebody, you have younger family who are able to work from home, be on a computer, to sit and try to get an appointment, those sorts of things, then you're going to have more access to this vaccine. Furthermore, what I would also say is that the way that we have rolled out this vaccine has been in a somewhat inequitable way, where other folks maybe have thought through a combined system of both older folks as well as essential workers. We know that because of a range of structural racism mechanisms that unfortunately, Black folks are less likely to live to the age of 65. So when we talk about rolling out vaccines to those 65 and older, we are disproportionately going to be focusing our attention on white residents.
And because I hear a number of different factors based on what you are saying. And going back to that, you're talking about some things that are happening. I want to go over to Dr. Tooks because I want to talk to you because you've actually seen people in luxury cars lined up outside of the hospital to get their vaccines. I want to hear about your experience and what you've witnessed.
Yeah, so the comments about the luxury cars on campus, it's just a reflection of the people who have access, like Dr. Bailey was talking about. What we have to really work hard to do is make sure that the people who are getting vaccinated reflect the people that we're taking care of within the hospital. In order to overcome that, Jackson has partnered with faith-based organizations, with community centers like the Center for Haitian Studies, really espousing a model of meeting people where they're at. I think it's very important when we go out to communities to listen to their concerns, to provide education, and then to provide easy access to the vaccine. The current system is very, very efficient. My uncle got vaccinated at Jackson and he was in and out in 30 minutes. But I helped him online and alerted him when it was time to sign up for an appointment. So that worked for him, but he was very dismayed that he was the only Black person in the observation area. However, Jackson has recognized that this is an issue, and Mr. Magoya, our CEO, has worked very hard to make sure that we're getting out into the communities that so desperately need this vaccine, because vaccine uptake in the Black community is the only way for us to achieve health equity. We are dying of COVID at much higher rates. We are infected with COVID at much higher rates because we are the front line, not just us doctors, but the people who clean the hospital, the people who work at our grocery stores. So it's very, very important for us to, properly educate the community on the safety and efficacy of the vaccine and really make it easier, really prioritize vaccination among our Black residents in this city, because that's the only way, we have higher rates of hypertension, higher rates of diabetes, higher rates of obesity, higher rates of HIV, all things that lead to worse health outcomes when it comes to COVID. So there should be a targeted effort in order to get the vaccine into Black communities. And, so the Mercedes and the BMWs are coming in, but I know that Jackson is really focused on going out. And so I've been very proud to be a part of that.
Dr. Tooks, and that's great. And we appreciate everything that you're doing, you and your staff and your coworkers. Thank you so much for your service. But you did touch upon something that's very concerning, and that happens to be the racial disparities. And Dr. Bailey, I want to ask you, how do we deal with these disparities? How do we address them when it comes to getting the vaccine?
So I'm going to go back to that kind of call to the inequities, right? Structural inequities. I'm kind of in a deja vu kind of sentiment right now, where a lot of the same problems that we had initially with starting up testing sites are some of the same issues that we have with the logistics and distribution around vaccines. So we have to be very thoughtful and learn from previous experiences that we've had, previous ways of engaging communities, right? So what that would look like is actually listening to people and actually, considering the concerns. So for example, I actually regularly participate in my mother's, affirmative aging group, which is part of their ministry at the Church of the Ascension, right? And being able to answer key questions. People have concerns, and sometimes it's based on key comorbidities that we've already recognized as, being, risk factors for very severe disease. We have to be dealing with that, right? And understanding structural racism, we know that inequity is our status quo. So if we're not planning thoughtfully and listening to people, we're going to default to inequity. So it's going to take a lot of planning and listening.
Yeah, you got that right. And someone out there that's listening is the NAACP. So let's get right out to Daniella. And I want to know what the NAACP is doing to increase the vaccinations in our community. What are you doing? Because you see the problem. You know that we have a problem.
Thank you so much for the question, and thank you for everyone who shared thus far. As the oldest and boldest civil rights organization, we believe and has always stood for equal rights and justice. As it relates to the COVID-19 vaccination, we are calling for the same equitable distribution throughout all communities of color. What we've witnessed is the rollout of the COVID-19 vaccination was heavily done on social media, using Twitter. And quite frankly, many of our members within the NAACP aren't on Twitter. They're not using social media like that. And it was a disparity to us that when we read reports that populations over in Fisher Island and others in more affluent communities were getting vaccinated at highly alarming rates, while we were less than 4% of that number. Now, let's be clear. The NAACP's position on COVID-19 is for equal access. It is a choice that an individual have whether or not to take the vaccination. We are pushing for equitable distribution so that those who decide to take the vaccination can make an informed decision. While there's a lot of urgency around the vaccination, there's also a lot of unknown and unanswered questions. The Black community is no stranger to unequal health care and unequal access. This stuff is systemic, and we have to tear those walls down. And how do we do that? By raising awareness to inequities. So I heard that Jackson has been around for over 100 years. A lot of these partnerships that they are starting to put in place today should have already been there. If they were already there, maybe we would not be scrambling around, raising awareness, rolling out our own plan to distribute the COVID-19 vaccination in our communities. That is totally unacceptable and, quite frankly, very unfair. If you're rolling it out for affluent communities with an ease, do it the same way within the Black community.
Very passionately said, Daniella. And I want to know what type of feedback are you getting from the community? You're talking about what's needed. But I'm curious as to what people are coming to you, telling you, or what are you hearing about the vaccine?
A lot of mixed messages. Some seniors are ready to take the vaccination, but they don't know how to access it. When they call a number, they're placed on a waiting list, while their peers and colleagues are signed up via Twitter for same-day appointments. So there's an inequity in how we sign up. I've also have heard from many members in the community that they're afraid. They're very afraid of the COVID-19 vaccine. Not enough people are talking to them in plain language. They don't understand it. Is it good for them? Will it impact their diabetes? I have high blood pressure. Should I take it? They just have a lot of unknowns and a lot of unanswered questions. And we are calling for more education and more engagement so that people can make informed decisions about their health.
Amen. Amen. And with that said, Dr. Bailey, I want to go back to you and I want to talk about the message. What message is missing, do you believe, for people who are still hesitant about getting the vaccine?
So regarding the messages, it's number one, first of all, have people received any messages? So going back to the Twitter, to the websites and that sort of thing, a lot of the people who I know in my community, they're not communicating by Twitter, especially if they're over 65. They're using WhatsApp. I know that's the case for a lot of people in the Caribbean, Latin America, who are trying to keep in touch with their families. They're not getting their information from Twitter necessarily. They're getting it from WhatsApp. And there's lots of information that's being spread that way. Lots of videos, lots of information, but maybe not necessarily a way to really communicate. So I think the message is someone who's there, who cares, who wants to impart information, not just as a kind of expedient way of getting rid of this pandemic, but addressing the true concerns that people have. I would say that there's a spectrum of skepticism, right? There are historical reasons why some communities are going to be more skeptical. And I think on top of that, it's not just the Tuskegee. It's not about the medical experiments. It's not about the forced sterilization solely. It is also about key experiences that people have right now. What about their diabetes? Is it going to have some kind of impact? Are they going to have a negative reaction? People want to answer those questions. If you have HIV, is that going to be okay? These are key questions that people want answered. And it's not sufficient for us to assume that we know what people are concerned about.
Very good point. And Dr. Tooks, you did have both doses of the Pfizer vaccine. So I want to hear from you. What do you want people to know about having those doses, about getting the vaccine?
Yeah, absolutely. So I actually went to Jackson and asked if I could be amongst the first group of people to get the vaccine because I wanted to show my patients, who are largely Black and brown, that I have done the research and I am certain in the efficacy of the vaccine and of the safety of the vaccine. So I was very honored to be one of the first 9 people in Miami to get the shot. I had a sore arm after the first shot. I had some fatigue and a sore arm after the second one. But, now I am immune to COVID, and I am listening to the concerns that my patients have, because their concerns are valid. We have to validate people's feelings, because, like Dr. Bailey said, these inequities in healthcare persist to today. That is one of the reasons that Black people die of higher rates from this disease. So we listen to their concerns and then educate them on the fact that there were 10% of the people in the Moderna trial were Black. 9% of the people in the Pfizer trial were Black. We are very well represented in these trials, and the vaccine is safe. And the only way that we're going to achieve any sort of health equity overall is for us to get vaccinated, so that the virus doesn't have a place to go and it stops spreading within our communities.
Amen. And very well said, all of you, and very passionately said, Daniella, and we really appreciate all of you, Dr. Tooks, Dr. Bailey, Daniella, Pierre. Thank you so much for this conversation. Unfortunately, we got to go with you guys, because we're going to get on to the myths and we're going to hear from someone else. But hopefully we can have another conversation here really soon about maybe the next few months or so, how things are going. We can't stop talking about this. We have to make sure our folks are educated. And most importantly, we got to make sure that they get vaccinated and that we protect them. So thank you so much for joining us for this all important conversation.
Thank you.
You got it. You got it. Well, we're going to move on now. We're going to talk about the medical mistrust. You heard a little bit about that in that conversation. So medical mistrust fueled by years of systemic racism. One reason why people of color are reluctant to take the vaccine. Another reason is misinformation. Untruths about the vaccine are spreading like wildfire across social media. So tonight, we're separating fact from fiction when it comes to the COVID-19 vaccine. John Gregory is a senior analyst and deputy editor for Health and NewsGuard, and he joins us tonight with more about all these myths out there that we continue to hear. And we're going to talk about the facts as well. John, thank you so much for joining us.
Thank you for having me.
You got it. Thank you. Well, first of all, what is NewsGuard? What is NewsGuard?
So what NewsGuard is a journalist-driven solution to online misinformation. Say you're scrolling through your Facebook feed, you search something on Google, you're going to get a lot of news results in any search that you do, but how do you know the source that you're looking at is reliable or not? What NewsGuard does is rate each and every site on 9 criteria, ranging from do they publish false content to simple things like do they disclose who owns the site or who writes the content, and comes up with a rating of the site's general reliability or lack thereof as kind of a first warning to people. If they're not familiar with the source, they will know their history of either being reliable or spreading misinformation like we've seen during the pandemic.
And let's talk about misinformation. John, how prevalent is misinformation online?
Oh, extremely. And it's been as worse as it's ever been in 2020. As you can imagine, there were a lot of opportunities for misinformation between an unprecedented pandemic that has disrupted all our lives, that presents such an opportunity for these bad actors in the misinformation space to spread new myths, get across their agenda, particularly on health. It's just been a boon for people, especially who are skeptical about vaccines. And as we expected at NewsGuard, we're seeing a lot of the same vaccine myths that would have been promoted for the swine flu, for measles, spread again, kind of put a new twist on them and promoted for the COVID vaccines.
Yeah. It's interesting because when you go back to the flu shot or even the measles shot back in the day, we didn't have social media like we have now. So then now I can't even imagine how it would have been back then with misinformation. But what does misinformation do to people? What does it do to the facts out there when you're trying to get people vaccinated and make sure that we're a healthier society?
Well, it can really exploit knowledge gaps and reasonable fears that people may have. They may be questioning why these vaccines were developed so quickly. How do we know they're safe if the time to develop them and the time to put them through trials was so much quicker than it has been in human history? Those are reasonable fear and reasonable concerns. And if someone they trust is not there to tell this person, this is why you shouldn't worry about it, this is why it's been tested and proven to be safe and effective, the misinformation actors that NewsGuard deals with all the time can fill that void, can fill that knowledge gap, and sow distrust and really just exploit the fears that people have coming into this whole process.
Okay, John, let's get right to it. So let's talk about some of the myths out there and, the common myths about the vaccine and how NewsGuard is debunking a lot of those myths. The first one up, let's talk about it. Myth: the mRNA vaccines being developed for COVID-19 will alter human DNA. What's the reality?
So this has been one of the broader myths that's been spreading since very early on in the vaccine development process. And so what messenger mRNA vaccines can do, they tell your cells to create a critical protein in the virus that causes COVID-19. And that's what gets your immune system working, creating antibodies against the virus without being exposed to the dangers of the virus itself. But this can't change your DNA. In fact, the mRNA is gone rather quickly from your cells once it's done its job. I've heard medical researchers compare it to like reading a recipe card or a Snapchat message. Your body gets those instructions, and then the message, the mRNA, disappears. And the concept behind it is really similar to other vaccines. You're creating an immune response without all the dangers of natural infection. But people are unlikely to have heard of what mRNA or mRNA vaccines are before the pandemic. I wasn't, and I cover this stuff. So if people have questions and they don't immediately get answers from someone they trust, that's where the misinformation opportunists can fill that void, that knowledge gap. And that helps them spread lies like this, and it's more likely to catch on. So what NewsGuard does is we can tell you, even before that specific claim came up, it was coming from sites that were very likely to have been rated unreliable by NewsGuard as it was. Mm-hmm. So if a site had said something like, the swine flu was created in the lab, or Ebola vaccines can give you Ebola, they're very likely to make a similar claim like this. And that just is kind of a first warning sign against, you shouldn't trust everything you read from this website.
Okay, and let's go ahead and get to a number of other myths as well. The next one, the COVID-19 vaccine has been proven to cause infertility in 97% of its recipients. So yeah, is there any truth to this?
No. And this one kind of shows you what kind of shaky ground a lot of these claims are built on. So this particular myth came from a British YouTuber who said he was relaying information from an anonymous source at a pharmaceutical company. So already few red flags there before we even get into the details of the claim. And once you do, you can see the just absurd level of misrepresentation. So that 97% figure, it was taken verbatim from a study published in 1989, so 30 years before this virus was identified. And as you can guess, the study was totally unrelated. The research was actually about the use of vaccines on baboons, not humans, in identifying treatments for cancers where the tumors might be affected by fertility hormones. But because they can say, oh, there's this study, they're probably relying on the average person not digging down to say, oh, this study was from 30 years ago. Oh, this study was done on baboons and had nothing to do with coronaviruses. In reality, the COVID-19 vaccines have not been linked to infertility, and this is exactly why they went through multiple phases of clinical trials, the last of which involved tens of thousands receiving the vaccine. And that's all before regulators comb through that data and they make an independent judgment on the vaccine's safety and efficacy.
Okay, we're going to try to pick up the pace because there's so many other myths I want to get to real fast. So just Go through and just let me know about it real fast, because these things have people staying away from the vaccine. Another one, John, happens to be government food stamps will be denied to those who refuse COVID-19 vaccines. What about this one?
This one relies on a lot of distortion. So in July, an infectious disease doctor co-authored a report at Johns Hopkins University. They recommended that health agencies collaborate with other government programs, including SNAP benefits, food stamps, as a way to ease vaccine distribution. Never suggested that food stamps or any benefit programs be withheld if someone turned down a COVID vaccine, and the authors actually had to come out and explicitly state they did not and would not advocate for something like that.
And this is a crazy one. This next one here, that Hank Aaron's death was actually linked to the COVID-19 vaccine. How in the heck did something like this get started?
Well, it's a pretty simple myth to unravel. Hank Aaron got the vaccine on January 5th. He died 17 days later. And anti-vaccine activists, I really think they were waiting for a celebrity to get the vaccine and then die shortly after it, just to tie one event to the other. But the local county medical examiner in Georgia, they determined that the vaccine did not contribute to his death. Aaron doesn't even appear to have experienced any side effects. It's just an unfortunate fact that 86-year-olds, even baseball legends, they die. And this is part of the opportunistic nature of that anti-vaccine crowd. They will exploit anything and everything based on no evidence to advance their agenda. And since COVID vaccines are not causing all sorts of horrible side effects, really serious reactions like they had promised, they need to exploit whatever deaths they can find in order to baselessly tie it to the vaccine.
Okay, and where, real fast, where can people fact check a rumor, about the vaccine? Where can they get that information?
Well, I would suggest installing the NewsGuard extension. You can go to newsguardtech.com to get that. And, just be vigilant about the sources you're reading. There's all sorts of very simple red flags to look to. If a site uses very emotionally charged language, or even something as simple as a lot of words in all caps, or doesn't seem to provide sources or makes broad claims that they don't back up with something specific, those are all real easy red flags to spot that might point the way to the site you're reading not being reliable.
You got that right. Thank you so much. Sean Gregory with NewsGuard, man, that was very, very informative, and something that many of our viewers can take away, because there's so much misinformation out there, and it's so easy for people to fall into that trap and believe each and everything that they read and see on the internet or social media. Thank you so much, Sean. We really appreciate you.
Thank you.
You got it. You got it. And everyone, this has been a very important conversation in regards, of course, to the COVID-19 vaccine. And we hope that maybe you will take something away from this, because it's extremely important. We believe that you get vaccinated, that you protect yourself and your families. Most importantly, if you have any questions, you heard from John right there. You can go online, you can get that information. Also, you can reach out to organizations, churches, and find out exactly what they're doing as well. But if you have any questions or anything, please feel free to shoot me an email, shoot me a text, follow me at Jawan NBC6 on our Facebook, Twitter, or Instagram pages. Let me know what you thought about the show as well. And remember, this is all about education. It is the key to success. If you believe, you will succeed. We'll see you next time. Have a great week.